Hi, I'm Molly, I'm one of the dietitians. I'm here to talk you through the Malnutrition Universal Screening Tool, MUST, which is how we get a lot of our referrals and is how we treat a lot of the patients in the hospital. First of all, we start with the BMI score, and depending on how low it is, they accumulate a score of 0, 1 or 2. Ideally, this is based on an actual weight and height, otherwise it might be inaccurate, and then you may need to use your judgment to see if you think it's right. Next, you do the weight loss score, and again you want an actual weight for this, because if they've got an estimated weight that was really high, it will look like they've lost a lot of weight when they haven't. And again, depending on how much weight they've lost, they get a score of 0, 1 or 2. Lastly is the acute disease effect. They may not have lost any weight and they may not have a low BMI, but if they've gone 5 days or looks like they will go 5 days with no nutrition, then they need to be referred and will get a score of 2. Next, you do their overall score. So this will range from 0 to a maximum of 6. And depending on what their score is, it changes their treatment. So during these difficult times, we're not taking as many referrals as we would be, and we will roll out guidance for that. If they've got a score of 0, they're low risk, routine. If they're score of 1, medium risk, observe, things like food charts, making sure you weigh them accurately. If a score is more or equal to 2, they're high risk. You need to continue the food charts monitoring, but we'll roll out guidance on things like nutritional supplements and measures you can take to reduce the risk of further malnutrition.
Hi, I'm Callum. I'm one of the dietitians here at Worthing Hospital. As we won't be able to see all of the patients that we would normally be able to during these highly busy periods, we thought it'd be a good idea just to run through some techniques that you can do on the ward to help support the nutritional needs of your patients. So these techniques can be applied to any of the patients that you've identified as being at high risk of malnutrition from using the MUST screening tool. So the first thing that we'd like you to try to do is to aim to give your patients snacks between meals and before bed. This will help to increase their overall nutritional intake, but this is especially effective for patients who have a poor appetite, as it helps to promote a little and often approach to their meals. Please speak with the catering staff on your wards to find out more information about what snacks will be available. Another technique that you can try is specific to patients that are struggling to feed themselves. So any patients you identify that are struggling, please consider implementing the red tray protocol. This will help to ensure that patients are getting the one-to-one assistance they need at meal times, and will highlight to other healthcare professionals that this is a patient they need to pay close attention to. For patients who have dementia or who struggle to use knives and forks but still want to maintain a level of independence, please consider using the finger food menu. This just helps patients, or it removes one of the barriers to eating that can present with patients who struggle to use knives and forks. For patients who might be experiencing a little bit of breathlessness, or for patients who have poor dentition, please consider using texture modified menu options such as the softened bite-sized menu or the minced and moist menu. This will help them to manage their breath at meals and can be more easily chewed and swallowed. Another useful tool for addressing any nutritional issues or poor intake can be nutritional supplements. So the first line supplements that we use on the ward are the Meritine milkshakes. These are high in energy and protein and don't leave patients feeling too full. You can give these between meals and before bed, as you would with the snacks. For patients who might struggle with the volume of Meritine milkshakes, please consider giving them 40-sip compacts. These do require a prescription from the doctors. And for patients who don't like milk-based supplements, please consider using the 40-juice supplements.
Hi, I'm Rosie, one of the dietitians. We are anticipating that we're going to have a large volume of patients who require enteral tube feeding during this time. So we will be primarily accepting referrals for patients who require enteral tube feeding and also parenteral nutrition. However, if you have concerns, for example a patient that's in a starved state and you're concerned that they may be at risk of refeeding syndrome, please do refer to us. Additionally, patients that have category 3 or 4 pressure ulcers, and you can contact us on extension 85669.